7 early signs of dementia few people know, and 13 classic symptoms to watch for. Dementia impacts millions of people worldwide, yet it's a condition often misunderstood. While many associate it purely with memory loss, dementia is a complex neurological disorder that can affect behavior, decision-making, communication, and physical coordination. But did you know that the signs of dementia often appear long before they're formally diagnosed? In this video, we'll explore 7 lesser-known early signs of dementia and the 13 classic symptoms that everyone should be aware of. By understanding these signs, you can help yourself or loved ones detect dementia early, when intervention can make the most difference. Let's get started by understanding dementia and why recognizing its symptoms early is so important. Dementia is a progressive disorder that affects brain function. It interferes with memory, reasoning, communication, mood, and even physical abilities over time. It's not a single disease, but rather a term that describes a group of symptoms caused by various conditions, the most common being Alzheimer's disease. People often dismiss the early signs of dementia as part of normal aging. While it's true that some memory lapses are normal as we age, dementia symptoms reflect problems serious enough to affect daily life. One of the key challenges is that the signs of dementia can start subtly, making them easy to overlook or explain away. However, these early signs are important clues. Identifying them can lead to earlier medical intervention, potentially slowing the progression of the disease and improving quality of life. Spotting symptoms in their earliest stages allows for timely intervention. Healthcare professionals can assist in managing the condition through therapies, medications, and lifestyle adjustments. Earlier diagnosis also helps families prepare and plan for future care needs. Now, let's dive into the 7 early signs of dementia that often go unnoticed. Struggling to follow a recipe you've made for years, or having trouble remembering how to use a common household device. Tasks that were once second nature may become challenging as one of the first cognitive effects of dementia. Shifts in mood, such as increased anxiety, confusion, or even irritability, might occur. These changes often go unnoticed because people may attribute them to stress or aging. However, they can signal underlying issues with emotional regulation linked to cognitive decline. An early warning sign of dementia is losing track during conversations. You might notice someone asking the same question repeatedly or forgetting what was just said. Staying engaged in discussions becomes increasingly difficult. Making a shopping list, organizing bills, or following multi-step instructions can become overwhelming. Problem-solving abilities, often affected early, may make even small decisions or plans seem daunting. Getting lost in familiar places is a common sign. Additionally, trouble judging distances or recognizing spatial relationships can lead to accidents, such as misjudging steps or bumping into furniture. Declines in physical abilities, such as difficulty tying shoelaces or using tools, may appear long before memory loss becomes noticeable. Frequent falls or trouble handling objects often accompany these issues. Dementia can impair judgment, leading to out-of-character decisions. Someone might spend money recklessly, become overly trusting of strangers, or neglect their personal safety in small but significant ways. Each of these symptoms might seem minor in isolation. However, if they occur frequently or in combination, they could point to the onset of dementia. Let's now examine the 13 classic symptoms of dementia, many of which become more apparent as the condition progresses. Forgetting recently learned information, important dates, or appointments and repeatedly asking the same questions is among the most recognizable symptoms of dementia. Tasks requiring sustained attention can become increasingly challenging. Someone might start a conversation or a chore, but struggle to follow through. Losing track of dates, forgetting which day it is, or feeling unsure of where you are, even in familiar environments, are common signs as dementia progresses. Regularly losing keys, glasses, or wallets isn't uncommon, but dementia adds the inability to retrace steps and find lost objects. This can generate frustration and confusion for the individual. Forgetting words mid-sentence, calling objects by odd names, e.g., that writing thing instead of a pen, or having difficulty joining or following conversations are indicators. Writing might also decline in clarity. People, places, and objects once recognized easily may start to appear confusing or unfamiliar. This symptom can be especially distressing for both the individual and their loved ones. Impulsive decisions, such as giving away large sums of money or making risky choices, stem from impaired reasoning abilities that worsen over time. Individuals with dementia may shy away from hobbies, work, or social engagements they once enjoyed, not out of disinterest but because of difficulty keeping up or fear of embarrassment. Difficulty sleeping through the night or growing fatigued during the day can disrupt routines. Some people with dementia experience heightened restlessness or wandering, especially at night. Bathing, grooming, and dressing appropriately may take a backseat to confusion or lack of awareness about personal care needs. Sudden mood swings, inappropriate responses, or heightened emotions like anger, apathy, or sadness are also classic markers. These are rooted in changes caused by dementia affecting emotional regulation. Previously learned tasks, like cooking a favorite dish step by step or following an exercise routine, become difficult to complete in the right sequence or order. Beyond cognitive decline, some people with dementia experience physical challenges such as tremors, unsteady gait, or even difficulty chewing and swallowing in advanced stages. Individually, these symptoms might not raise alarms, but in combination and with increasing frequency, they are strong indicators that professional evaluation is needed. If you or a loved one are experiencing several of the described symptoms, it's important to consult with a healthcare provider. Early diagnosis can help determine whether cognitive decline is linked to dementia or another condition, such as depression or a vitamin deficiency, which are sometimes reversible. A doctor may perform memory and cognitive tests, imaging scans, or blood work to identify the cause and determine the best course of action. Starting treatment as early as possible can help slow the progression of dementia and improve overall quality of life. Recognizing these symptoms in a loved one can be emotionally difficult. However, handling this situation requires empathy and patience. Approach them gently with your observations, making them feel supported and not judged. Encourage them to seek medical attention together for better understanding and care planning. Dementia affects a person's life, but with knowledge, early action, and support, it doesn't have to define them entirely. Raising awareness is critical in helping more people understand the importance of recognizing early signs and addressing dementia head-on. By understanding these symptoms and sharing this knowledge with others, you become part of a larger effort to combat the stigma surrounding dementia. Prevention, intervention, and care can all benefit from enhanced awareness. Today, we explored the 7 lesser-known early signs of dementia and the 13 classic symptoms that people should know. These symptoms, while sometimes subtle, are crucial for detecting dementia in its early stages and improving outcomes. If you notice these signs in yourself or someone you know, don't wait. Take action by consulting a healthcare professional. Together, we can tackle the challenges of dementia with compassion, education, and support. Be sure to share this video to help spread awareness and understanding about dementia. Early recognition is the key to better care and a brighter path forward. Thank you for watching.